Balance is a fundamental part of healthy movement, especially for older adults who may face unique challenges as they age. This course is designed to provide you with a clear framework for understanding the factors that influence balance, along with practical assessments and exercises tailored for older adults. With these tools, you'll be equipped to guide clients through safe, effective progressions that prioritize both safety and quality of life. Hi, my name is Bethany Russell. I'm the director of the Balance program here at Kinis AI. I have my doctorate in physical therapy, and I'm a practicing physical therapist in Virginia. I specialize in gait and balance, and so I had a great time writing this course, and I'm really excited to share this information with you. Hope you take a lot away from it. As a disclaimer, if a client is having falls or other signs of a medical problem, of course, please refer them to their physical therapist or their doctor. This course is not intended to ask you to step outside of your scope of practice. Rather, it's intended to offer you some useful information for working with clients who are post-rehabilitation and still want to improve their balance more or have mild balance problems without any red flags for a major medical problem. For people who are reporting falls or fear of falling, there are common safety tips that you can still recommend, and these are in pretty much everyone's scope of practice to suggest. This includes things like make sure they're drinking enough water. You'd be surprised how many people are dehydrated, and that can interact with many underlying causes of balance disorders. You can also recommend use of night lights for those middle-of-the-night trips to the bathroom. You can recommend that they check their home for area rugs or cords going across walkways, anything that could possibly be a trip hazard. You can also recommend that if they're on any new medicines or they take multiple medications, check in with their physician or pharmacist to make sure those are not impacting their balance. Now, the CDC Steady initiative provides an easily shareable document that has all of these tips and more that you can share with clients if you wish. Another recommendation is to make sure your clients are wearing supportive shoes. Usually athletic type of shoes are best for balance. And again, the CDC Study Initiative provides a great fact sheet with more information about proper shoes. Finally, you can encourage clients to return to personal training once a physician or physical therapist gives them clearance. The majority of people with balance disorders also have some level of general deconditioning and would benefit tremendously from supervised and individualized strengthening and conditioning. Now first, we'll discuss the senses that we use for balance. Many factors influence overall balance function, but in general, we use 3 sensory systems for the input in our balance. Those systems are as follows. First, the vestibular system, or the inner ear. This is how we know how fast our body is moving. It's part of how we know what position we're in relative to upright, and it's closely connected with eye and head movements. It's also stimulated by variable movements, and it often gets a bit weaker as we get older. If you imagine a healthy child, that healthy child runs, balances on curbs, does cartwheels, swings on swings, rolls down hills. All these things stimulate the inner ear, and it's part of why you don't really see children with balance disorders. As adults, our movement variability often decreases sharply, and so our vestibular system gets less stimulation, and it's a use it or lose it scenario. The second one is proprioception. This is our knowledge of where we are in space. There are specific receptors for this in our joints and tendons so that we know how flexed each joint is and where each body part is in space. This is how you could have your eyes closed, but tell me exactly where your hand is. Now, anything that harms joints, which includes sprains, surgeries, arthritis, as well as pain and swelling, can all reduce our proprioception in the affected area. However, proprioception can be improved with practice. The final sense is vision. This is why it's always harder to balance with our eyes closed. Now, normally our bodies should be able to use all of these 3 senses to help us balance and switch which system we rely on based on the situation. So at night, we should be able to rely on the first 2, and if we're walking on something like mud and so it's harder to use position sensing from the feet, we can lean more on vision and the vestibular system. However, most people with balance problems are overly reliant on vision. This is a big theme that should be confirmed in each individual client and specifically addressed if indicated. So keeping our balance then depends on accurate, complete, and timely information from those 3 sensory systems and the ability to integrate that information in our brain and our spinal cord, and then an adequate motor output. We have 3 main movement strategies to prevent falls. First is the ankle strategy. Small motions in the foot and ankle respond to normal sway of the body and correct the tilt of our whole body over the ankle. This is how healthy people self-correct after small disruptions to our balance. To feel this, you can stand on one foot and notice what your ankle does, or if you're standing on 2 feet, you slowly lean your whole body forward like a skier, you'll feel your calf muscles kick in to stop you from going too far. Normal output in an ankle strategy requires normal strength in the calf muscles, the anterior tibialis, posterior tibialis, and the fibularis muscle groups. It also requires healthy nerves to quickly carry the signals to the muscles to contract fast in response to body sway or shifting your weight. This also requires normal strength in the small muscles within the feet, the foot intrinsic muscle strength. This is actually correlated with balance function in older adults. Now, there are 2 groups of people who are very often going to have trouble with using an ankle strategy effectively. The first are people with chronic ankle instability, or people who have repeated ankle sprains in their medical history. This is a common problem and can result in long-lasting difficulty, both with proprioception at the ankle and with the function of the fibularis muscle group. The second group is people with peripheral neuropathy. Neuropathy usually starts in the toes, and as it progresses, it moves up the legs. Damage to the nerves means that signals can't get to the muscles at a normal speed. Now, foot intrinsic and ankle muscles are often weakened from the forced disuse of the nerves being unable to activate them. So if the ankle strategy can't correct a balance disturbance, then we move to a hip strategy. So the second movement strategy consists of larger movements from front to back or side to side at the hip joint. And this is meant to be in response to larger disruptions to our balance. The most common weak point here is hip abduction. And this is typically because of weakness in the gluteus medius and maximus muscles. Most people with balance disorders will not have normal hip abduction strength, which is important to keep in mind because this is often one of the simplest factors to address with a really high return on investment. Now, if the hip strategy doesn't correct a balance disturbance, then we move on to a stepping strategy. As it sounds, a stepping strategy is when we have to take a step to prevent a fall. This is for the largest disruptions to our balance, such as someone shoving you or catching your toes on a rise in the sidewalk that you didn't see. The stepping strategy is often the last line of defense against a fall, so it's crucial to be able to move very quickly. Now, muscle power, quickly producing force, decreases much faster than muscle strength with aging. Keep this in mind when you're working with clients with balance goals, because ideally, unless your client has contraindications, their program should include properly scaled plyometric training for this reason. Now that we've discussed the mechanisms behind balance, let's discuss methods for measuring someone's balance function. For assessments, typically you'll want to look at both static and dynamic balance. Most of what first comes to mind with balance testing, standing on one leg or standing with one foot in front of the other, are all static tests. But falls are most often going to occur when we're moving around or walking, so we need to see that in action as well. And also, the research is pretty clear that balance is task-specific, meaning static balance actually doesn't always correlate very well with dynamic balance ability. So let's discuss some options for balance testing. For our static balance tests, as I mentioned, we have one leg standing time as an option. Now, normal balance ability varies significantly with age, with young adults being expected to last almost a full minute on one leg, and people 80 years or older expected to balance for more like 14 seconds. You can also test eyes closed balance on one leg. Now, expect this to be a great deal harder, and if the client is at risk for falls, make sure you have safety strategies in place, like an immovable object in reach that they could grab safely. And truly, you're going to want to keep that immovable object in reach really for all of your balance assessments and during all of your balance training. Really, you should assume that your client is at risk for falls and is not going to recover safely until they prove otherwise, and if you always assume this way, very likely going to have much fewer safety incidents. Now, during the one-leg balance test, watch their foot and ankle. Normal would be frequent small movements to correct normal sway, the ankle strategy. Now, as someone is about to have to put their foot down, you will usually see a hip strategy. We will provide on the screen some normal one-leg balance times for different ages for your reference. Now another test you can do is tandem stance, or standing one foot in front of the other. And normal function with this test would be the ability to place one foot in front of the other, the heel touches the toes without holding on to anything, balance for at least 30 seconds in this position, and then smoothly and calmly return to normal standing. Once again, watch their foot and ankle. Normal would be a lot of small movements here, or no movement if they're very steady, with limited movement elsewhere in their body. Now, if they can't do this heel to toe, you can regress through some other levels to kind of find what they can do. So from harder to easiest, we have one foot all the way out with the front foot a little bit widened. We have one foot halfway in front of the other with no space in between. We have the feet right next to each other, or as close as they can get to touching, or one foot halfway in front of the other with some space in between. What you're going to want to do is note which level they can hold for 30 seconds with a lot of effort. This position will be an easy way to start working on standing still or static balance. Now, a final static balance test that you could choose would be feet together with eyes closed. Normal would be 30 seconds with this test. Now, if this test and others that prevent the client from relying on vision go very poorly, you'll know you should definitely incorporate a lot of balance exercises with eyes closed into your programming. Next, we'll discuss dynamic balance assessments. Now, these do bring a bit more inherent risk, so make sure to consider safety again before attempting these. If a client is unsteady, often I'll walk beside them and hold my arm out as if offering to give them a hand so they could quickly grab my arm or hand if they stumble. And if a client says they don't want to try one of these tests, just score it a 0 and don't push your luck. So here are 3 options to test dynamic balance. The first is heel to toe walking. Normal function with this test would be 14 to 20 steps in a row with the arms across the chest, and with each step, the front heel touches the toe of the back foot. Another test you could do is backwards walking. Of course, make sure you're watching behind them. But normal function here would be that the client can walk backwards at least 20 feet without hesitation and at a speed that's very close to their typical forward walking speed. A final option would be walking while turning your head. While walking forward, normally we should be able to turn our head to the right, to the left, up, and down without really slowing down our pace and without changing our gait pattern. I also wanted to quickly discuss assessing balance during transfers. So depending on what your client tells you they have trouble with, you may want to assess how well they can balance with normal transitional movements. So 2 options would be floor transfers and sit to stands. So for floor transfers, you're simply looking at, can the client move from a standing position to lying down on a floor mat and back into standing without support from an outside object. And then for sit to stand function, a common test that is used a lot in physical therapy is called the 5 times sit to stand test. Now, this is in the Kinis app. This test is also well within a personal trainer's scope of practice. So the test is performed on a standard height chair with the hands across the chest. And when the trainer says go, they start the stopwatch and the client stands up and sits back down 5 times in a row as fast as they can. Now, they do need to stand all the way up. There's a common cheat where people will stand up halfway and not fully straighten the hips and knees to save time, so just watch for that. So once they've stood up and sit back down 5 times, their bottom touches the seat for the 5th time, and the stopwatch stops then. Now, this test should take less than 10 seconds if the client is younger than 70, and for ages 70 and older, it should take right around 10 seconds for normal function. If this test takes longer than 15 seconds, that's an indicator of fall risk. And this test is nice because if they have an abnormal time on the first day, the test is often very responsive to strengthening interventions. So you could test it again in 4 weeks or so and have an objective sign of the client's improvement. Next, let's discuss a few range of motion assessments that are relevant to balance. So again, depending on the client's specific presentation, you may want to perform a few simple screens for range of motion, like the following 2 options. You can screen for hip extension using the Thomas test to assess for normal hip extension flexibility. If the client can't access neutral hip extension, they're stuck in some hip flexion, they'll have to either constantly compensate at another joint or forward flex their trunk. And of course, that's going to pull their center of mass forward and disrupt their balance. The other thing you may want to assess for is spinal extension range of motion, especially at the lumbar and thoracic spine. This can easily be screened with some simple standing range of motion even just seeing if they can get a decent amount of lumbar extension and a decent amount of thoracic extension. As with the hip, lost spinal extension range of motion can force clients into a forward flexed posture, so they're always fighting their center of mass, pulling them too far forward. Now, another specific factor you may want to measure in some of your clients is balance confidence. So to assess balance confidence, there are multiple surveys that ask the client how confident they feel about their balance, and these surveys have been validated by research studies. One of the most commonly used surveys is called the Falls Efficacy Scale International, which has users rate how concerned they are about the possibility of falling during 16 normal movements or activities. So a higher total score indicates more concern about falling, and scoring higher than a 24 on this survey has been established as a risk factor for falls. Let's discuss how we move quickly from assessments to solutions. So the whole time you're completing whichever test you chose as the most appropriate for the client in front of you, you're going to want to watch for the following 5 components. Of course, the first is the time or the repetition. Can they complete the expected amount of time or the expected number of reps that research has established as normal for their age or their demographics? And is this vastly different if they close their eyes? Next, we have 4 quality components to consider. With every test, we've mentioned you want to look at their ankle stability. If they're standing still, is their ankle still at least some of the time, and are the corrective motions only small movements? And throughout the testing, do you notice the foot excessively rolling out to one side or the other, or do you notice the toes moving abnormally? So you can watch for all of these. The next thing to watch for is hip and pelvic stability. If you could draw a line up their standing leg thigh and then across their hips about where a belt would sit, does that horizontal line stay very close? Research suggests within about 5 degrees to perfectly horizontal, or are they frequently raising or lowering one side of their pelvis? And you also want to watch, are they twisting abnormally around one hip as they're trying to keep their balance? Next, you want to be observing their trunk stability. For standard tests like one leg balance or walking backwards or heel to toe walking, there's no reason for the trunk to be tilting or twisting. So if you can imagine a line between their standing side hip and their standing side shoulder, that line should stay within about 10 degrees from perfectly straight the whole time. You also want to observe their body sway. If you could draw a line from the center of their base of support up through the center of their trunk and then watch them sway their whole body off of that line, those sways should be very small and should always be followed by returning to the midline. Now, research does suggest that older adults may have a harder time than younger adults controlling their sway quickly when their balance is disturbed. The quality components can guide you to design more specific exercises to address the underlying problem limiting balance, while the time or repetitions components allow you to measure the objective result of training over time and allow you to determine fall risk. Now, the ankle, the hip or pelvis, and the trunk stability can often reveal strength problems. So if you notice clients consistently failing in one of those measures, you can choose exercises that isolate those areas while also challenging balance. Body sway issues may indicate an issue either with normal sensory input, integrating or switching between relying on different sensory inputs, or fast enough motor output. People who consistently score poorly on the body sway component probably need more focus on classic balance exercises where they have the opportunity to practice managing their body sway more efficiently when their balance is challenged. Next, we'll go over how to build an exercise program to improve a client's balance. First, we'll discuss some overarching considerations for all balance training programs. First, be specific in terms of addressing which factors the assessments indicated as the most problematic. Specificity of training very much still applies here. Also, be intentional with your strengthening exercise selection. If there's a variation of an exercise that can be done in standing instead of in sitting, make the switch. Just like you wouldn't tell a swimmer who wanted a faster 100-meter swim time that their best bet is running, don't expect exercises completed in sitting, of course, to make someone steadier on their feet. It's also important to know what your client is capable of. In the healthcare continuum, Historically, a lot of ageist myths have snuck into treatment paradigms. And I strongly believe this calls for all of us practitioners to consistently examine our own methods and look for and root out ageist bias. Also want to consider salience, or how important the exercise is to someone. People will really only fully engage in exercises that they truly believe will help them. So make sure your balance tasks are as specific to the client's goals as you can. Or if your exercises need to be kind of boring and repetitive, use your break time in between sets of more interesting exercises to do some repetitions. You can also ask your client when they feel most off balance and see if you can safely simulate those exact challenges. We also want to consider challenge level. Just like in strengthening, the concept of progressive overload is crucial to get right for balance training. You'll need to scale activities so that they're possible for the clients to complete without holding on for support, while also making the task hard enough that they have to exert effort to sustain their balance. The next thing to consider is salience, or importance. So people will only fully engage in exercises that they truly believe will help them. So make sure your balance tasks are as specific to the client's goals as you can. Or if the exercises just kind of need to be boring and repetitive sometimes, use your break time in between sets of more interesting exercises to do some balance repetitions. You can also ask the client when they feel most off balance to see if you can safely simulate those exact challenges in the gym. You also want to consider challenge level. Just like in strengthening, the concept of progressive overload is crucial to get right for balance training. You'll need to scale activities so that they're possible for the clients to complete without holding on for support. As long as they are gripping on a railing, they're not really practicing their true balance strategies. So they need to be doable enough that they don't have to hold on the whole time, while also making the balance exercise hard enough that the client is having to exert effort to sustain their balance. And this can be pretty frustrating to experience for the client. I'll often use the analogy with my clients of muscle burning. So if I did bicep curls with a pencil, my muscle wouldn't burn at all, so I would know it wasn't enough weight to trigger a positive change. When the client has to grab a support surface briefly, or they start to really wobble, or they have to temporarily set a foot down during a balance exercise, that's the same as that muscle burning sensation, letting me know I'm challenging them enough to promote a positive change in their balance. We'll also discuss anticipatory versus reactive balance. Anticipatory balance refers to strategies to prepare for a known balance challenge. Like if I'm walking down the sidewalk and I see that I'm about to step on a stick, then my body would naturally slow down my walking pace, shift my weight further over my standing leg so I have time to lift my stepping leg extra high to get over the obstacle. Reactive balance strategies refer more to how I recover when I didn't see the balance challenge coming. Like if I was texting and walking, so I didn't see the stick and I tripped, and that sent my body tipping too far forward, so my body might naturally choose to take a couple of running steps forward to regain control of my forward momentum. Now, why is this important? Because reactive balance training is also very effective for reducing fall frequency for older adults and people with balance impairments, and even shows up in some research studies as even more effective than traditional balance training. One simple way that you could begin emphasizing reactive balance practice is during your balance exercises, ask the client to try to take a step to recover their balance before they just grab onto the nearby support surface if they safely can. Now next, we'll go over each of the quality components we discussed previously during balance assessment so we can build individualized and specific balance exercise programs. We'll start with body sway. Here are some ideas for exercises to improve body sway and visual reliance. Now, the idea behind all of these is to trigger some of that body sway, giving the client the opportunity to repetitively practice managing that response and staying upright without having to grab onto something. So first, remember the levels of tandem stance. So a very simple place to start is to find the level that the client can hold for about 30 seconds with a lot of effort. So you'll want to see a lot of the ankle strategy going on, probably some extra whole body sway, and have them repeat just holding that position for 3 to 6 sets. Now, ideally, this kind of thing will be practiced every day. I'll often recommend that people do this while brushing their teeth or waiting for their microwave or their coffee to brew. This would also be an easy exercise to program into the rest breaks between sets of strengthening exercises. Ideally, this type of thing will be practiced every day. I'll often recommend that people do this exercise while brushing their teeth or waiting for their food in the microwave or waiting for their coffee to brew. This would also be an easy one to program into rest breaks between sets of strengthening exercises. You could also use this foot positioning instead of normal standing during an upper body exercise. And also remind your client to practice this position with both their eyes open and their eyes closed. At the same time, this type of practice is far from the whole program. Research has specifically shown that just practicing balance while you brush your teeth twice a day is not enough to improve balance function. For effective programs, we need this to look more like 2 45-minute sessions per week for 8 weeks for athletes and 3 30 to 45-minute sessions per week for 12 weeks for healthy older adults. Usually these will occur as a mix of supervised and unsupervised sessions because obviously most people or their insurance are not willing to pay for that much personal training or physical therapy. The next exercise I will recommend for body sway is backwards walking. In general, backwards walking is a great way to start to reduce reliance on vision. You can cue your client to be precise with their foot placement and focus on how the pressure is moving through the bottom of their feet instead of having to look down as they walk. You can also work on heel to toe walking. This is a classic balance exercise. And the key here is if you have a safe environment to practice this, focus on recovering the loss of balance with a stepping strategy if you can. Another great exercise is crossover stepping, alternating stepping across in front of the leading foot and then behind the leading foot. Crossover stepping is an important skill for stumble recovery. Many times when we trip, our feet will get crossed. And if that's the case, you have two options: be able to uncross your feet or fall down. Another great exercise is figure eight walking around 2 cones. All of the turning and the neck motions required for this task provide some extra stimulation to the vestibular system, the inner ear. Plus, turning while walking is a common time that people report noticing their balance problems. You can make this task even more challenging by adding a dual task like tossing a ball with them. Another exercise for working on body sway is called diagonals with a gaze follow. So for this exercise, you pick a foot position that is mildly challenging for balance, and then you hold a light object, or if the client can tolerate it, a small weight in both hands, and you keep your elbows straight, and then you're just going to make a large diagonal line from the back hip up overhead. You're also going to pick a spot on the object and follow that spot with your eyes. So then the eye movements and the head turns, again, stimulate that vestibular system or the inner ear. This is very likely to trigger some of those body sway so that you get the opportunity to practice managing that. Next, we'll discuss options to improve foot and ankle stability. Research has shown that exercise programs that increase foot intrinsic muscle strength contribute to improvements in balance function. One of the main ways I like to cue people to improve their use of foot intrinsic muscles and normal ankle strategy is with the foot tripod cue. The 3 points of the foot tripod are the pinky toe knuckle and the center of the heel. Anytime your feet are staying on the floor and you need to balance from standing on one leg all the way to doing squats and deadlifts, if you can keep your weight spread evenly across the 3 points of that foot tripod, theoretically you can't lose your balance. So if I'm working with a client who's practicing a balance exercise, I often find that if I explain the foot tripod to them, they will immediately get a bit better at the balance exercise. Most often, people lose the big toe part of the foot tripod, so sometimes I'll ask them to imagine they're hiding something or trapping something under that knuckle to help them focus on keeping that part of the foot on the floor. And then here are next some exercises to really focus further on this foot tripod. So standing in a position that challenges the individual client's balance, whether that's feet together, one foot halfway in front of the other, or all the way up to a one-leg balancing position. Once in this position, have them focus on establishing their weight evenly over the foot tripod. Then you can distract them by tossing a ball or even a medicine ball if they can handle that, so that every time they have to reach to catch the ball or put some effort behind tossing the ball back to you, their balance will be disturbed and they have to practice recentering their weight properly over the foot tripod again. They can also just toss the ball up and down to themselves or bounce the ball off of a wall so that they could practice this same type of task at home. Another idea is to have the client stand right beside a hurdle or anything that can substitute for a hurdle and reach one foot over the hurdle to tap the heel gently on the other side, bring it back beside the other foot, and repeat. And you can progress this by raising the height of the obstacle or adding an ankle weight. Another idea is simply walking on the heels or walking on tiptoes. These can be great ways to strengthen the front or the back of the lower leg muscles while also challenging balance. And remember, if the ankle strategy fails to correct a balance disturbance, then the next line of defense is a hip strategy. So next we'll discuss how to improve hip and pelvis stability. Remember how the hip abductors are often weak in people with balance disorders? So your best bet for people with limitations in hip and pelvis stability is to design exercises that both work the hip muscles and challenge balance at the same time. So here are some ideas for that. This could include walking lunges, even partial depth if needed. This can include step-ups. I like to have a support surface nearby, but focus on a slow pace and using a height of a step that they can perform without using their hands if possible. And there's always the option to hover your hand over the railing for safety as you move, so it would be super easy to grab it very quickly if the client started to lose their balance. Another great exercise is sidestepping against a band. The lower the band is on the legs, the higher the gluteus medius activation required. So around the knees is a great way to start, around the ankles will be harder, and around the middle of the feet will be the hardest. Another exercise you can use is standing on a step and touching the outer leg to the floor without putting weight on the moving leg. Obviously, this is a partial single leg squat, and so this is a bit more advanced. But you can progress this exercise by touching the heel down instead of the toes to force a deeper squat. Another exercise is toe taps on a step, and you can progress this to a small cone or something that can easily be crushed or knocked over so that they have to stand on one foot longer in order to more gently tap the object. Finally, another exercise I really like for hip and pelvic stability is standing in front of a step, and what we'll have them do is have one foot rest on the step. So most of the weight will be on the back leg, which is the focus of this exercise. I'll usually have people perform this in front of a mirror so they can make sure that the standing side, hip, and shoulder are aligned. So if I lose my hip stability and my active engaged hip here, you'll see the hip kind of sink to the outside of the shoulder. So I'll have them watch for this straight line that's coming from the hip stability muscles on my standing side. Then the client can practice maintaining this straight alignment while marching the front foot up high and quietly setting it down on the box. The whole time they're using these hip muscles on the back leg to maintain the same stable alignment that they need to balance in the middle of every step while they're walking. Now, one possible reason someone might use excessive hip strategies to balance is if their trunk isn't stabilizing effectively. So let's discuss how to improve trunk stability. Research suggests that trunk muscle strength is associated with balance ability, and in older adults, multiple studies actually point to the back extensors being more important than the trunk flexors for balance. This does make sense given how many people have trouble with upright posture and how important upright posture is for balance function. So improving trunk stability during balance will usually look like any exercise you can design that makes it difficult for the client to maintain a straight and still trunk while challenging their balance at the same time. So here are some examples. There's the weight switch exercise. For this exercise, you'll choose, again, a mildly challenging foot position and then take a moderately heavy weight, and you'll have the client just pass it to their other hand in front of and behind the body, and they'll continue this in slow and controlled circles, keeping their core braced so that the trunk doesn't lean or twist at all. Another great exercise are loaded carries. Feeling uncomfortable carrying something is a very common balance complaint. So you may already be familiar with the suitcase carry as a great exercise for grip strength and core stability. I especially like having the weight only on the one side for balance work because this will cause a lot more gluteus medius and back extensor activation on the opposite side from the weight. You can make this even more challenging by having your client walk forwards with high knee marching, or walk backwards, or walk sideways while carrying the heavy weight on the one side and really focusing on maintaining their nice straight posture. Other great exercises here are things as simple as planks and side planks. These strength exercises will still challenge their trunk coordination and will challenge them to maintain their position sensing significantly. And sometimes we do just need a little bit more basic strength in the trunk to be able to maintain good posture for longer periods of time. You might also use the bird dog exercise here. For this exercise, the client starts on their hands and knees and reaches out one limb at a time and can progress to reaching out the opposite arm and opposite leg. This will again challenge trunk strength, trunk endurance, and position sensing. And the opposite arm and leg reach kind of mimics the way the arm and the leg move reciprocally while we walk. You can also use a loaded push or loaded pull, a traditional sled push or sled pull exercise, and focus again on maintaining a straight and neutral trunk and a braced core throughout. Again, we can build up some simple trunk strength and endurance with these methods. I'd like to discuss dual tasking for a moment. Dual tasking is an important component of normal balance ability. Can I maintain my balance while I'm thinking about something completely different? And older adults may perform worse in dual task conditions than younger adults, according to some research. So to work on improving this, typically, it'll look like any of the static or walking balance exercises that we've discussed previously, with one of two types of dual tasking added on. We can add on a motor dual task. That might be things like adding in a ball toss, tossing the ball straight up and catching it with yourself, bouncing it off the wall, balancing an object in your hand so that you have to carry it very carefully, or you can carry it low, or if they don't have shoulder pain and you want to work on upright posture, you can ask them to hold the weight very high while they perform a balanced task. You can also have them carry a large yoga ball. I like to use this so that people can't look at their feet as they do a balanced task. Now, the other type of dual task you could layer onto your balance exercises is a cognitive dual task. So this will often consist of things like naming or recall tasks, such as, so maybe the client is backwards walking or tandem walking, and then you're calling out a letter of the alphabet and you are expecting them to name a food or an animal that starts with each letter that you called out. You can also have them go through state capitals, anything that has them really think about something completely unrelated to their balance, and that's practicing making their balance function more automatic, which is how ideally that would function in real life. Now finally, let's dive a little bit deeper into that last line of defense to prevent a fall, the stepping strategy. As we mentioned earlier, all movement strategies to recover balance have to be fast enough to be effective. Plyometric training is supported by research as an effective method to improve balance. So if you have a client who has trouble moving fast, here's some exercise ideas from the lowest level to the most challenging. So first we'll discuss a task I call anticipatory stepping. So for this exercise, you start with just taking a large step forward, pausing for a second to ensure your balance, and then trying to come back in one step. And this movement can be practiced to the front, you can practice it stepping to the side, and you can practice it stepping to the back. And if that goes well, and of course you have a safe environment to practice this in, you can progress to initiating this with a lean. So you lean forward like a board until it's too far so that you trigger a recovery step. Another option is to just perform sit-to-stands as fast as possible to work on power production. Another exercise you can use is mini hops. The thing about hopping practice is even if the client needs to start with two hands on a support surface or laying down on a total gym, if someone walks very slowly and you can get them to safely work on regaining the ability to generate that force very quickly, again, even in a very supported environment, practicing any kind of jumping pattern can be a great start to train their ability to move quickly enough to hopefully be able to generate an effective stepping strategy. I also like to use running short distances. So something I do with many of my balance clients is, again, assuming we have a safe environment for this, ask them to do just a few repetitions of running a very short distance, 20 feet or less, as long as they don't have pain with it. The thing is, they don't have to be a marathon runner. If you trip and you need to run out of it to keep your balance, you just have to be able to run a few steps to prevent a fall. Also, running even very, very short distance can be a great way to build confidence. Now, if a client isn't capable of running, a regression would be to start in a chair, stand up, walk to a target, return to the chair, and sit down as fast as safely possible. Another great exercise in this category is bounding, jumping off of one foot and landing on the other, whether that's to the side or to the front. So this is sort of another level up from a few jogging steps. Again, you can practice this in all directions. At this point, we're getting some pretty good ankle strength and stability challenges. And the side bounds can be progressed to skaters, where you have to reach the trailing leg behind the lead leg after you land. And of course, you can also progress this by working on longer jumps. And then finally, single leg pogos, where you are staying on one leg and hopping again side to side, front to back. Because we're staying on the one leg the whole time, it's even more ankle stability and general balance challenges. And we're looking for very light and quiet feet here. Working on balance with older adults goes beyond just preventing falls. It's about restoring confidence and improving quality of life in ways that are both functional and empowering. By carefully assessing each client's specific needs and applying the principles and exercises outlined here, you can support meaningful gains in balance, strength, and independence. Even small improvements can make an impact, so keep your approach safe, adaptable, and encouraging. With the right guidance, your clients will build a more stable foundation for moving through life confidently.